Welcome. Thank you for coming. I realize we're competing with a lot of other exciting events right now. Gary White. I mean, we might not know Matt Damon, but we do have Halloween candy. So I think you made the right decision. Welcome to Tap In. We're going to be talking about building sector capacity for implementing and sustaining inline chlorination. We have an exciting program, and it's also the launch of Mangrove Water's new playbook for implementers that provides guidance. We'll be talking a lot about it. That provides guidance and installation protocols with a technology catalog for implementing inline chlorination globally. So we are going to just do a brief introduction to what inline chlorination is. Then we're going to have presentations from funders, policymakers, and implementers. We have Givewell here, we have the World Bank here, and we have Uduma and Self-Help Africa. And then we'll do a brief introduction to the playbook, and then we'll do some brainstorming around what additional resources the sector might need to overcome barriers to scaling inline chlorination. And then we're also going to do some breakout groups, and there will be prizes for breakout groups that perform well. So if you're thinking about leaving when we get into breakout groups, don't. There's going to be prizes. So please stay for the breakout groups. They're going to be fun. And then we'll do a quick conclusion. All right, so just to get everyone engaged, we're going to start out with a little bit of trivia. If you get this right, you get some Halloween candy. What is the main limiting factor preventing access to safely managed drinking water? There's multiple criteria, obviously, that are important for getting safely managed drinking water. It has to be accessible on premises. You have to have supply available when needed. And it also has to be free from fecal contamination. Which one of these things is the primary limiting factor? In the back. Huh? Number 3, yes, yes, okay. You get some. Okay, so this is a recent science paper that mapped out safely managed drinking water around the world. And you can see that fecal contamination is the primary limiting factor here, responsible for nearly half of the 4.4 billion people that lack access to safely managed drinking water. Okay. So this is why inline chlorination is important, right? To inactivate pathogens and remove fecal contamination from drinking water. Some advantages of inline chlorination are that it removes the burden of manual dosing off operators and users. It doesn't change the way that users are accessing water from their drinking water sources. The whole idea here is to develop technologies and devices that can be compatible with existing infrastructure around the world. And we know that infrastructure is really diverse, right? So it's a challenge, but there's a lot of devices now that are compatible with existing infrastructure around the world. Another advantage is that devices don't require electricity, and they can be very cost effective, and Givewell's going to be talking a bit more about the cost effectiveness of inline chlorination today. Okay, next trivia question. How many people use sources in the world compatible with inline chlorination and that contain fecal contamination? So what is our global target market here? Anyone know? Dave knows, it's also in his talk.
Oh, we're not saying.
Anyone want to take a guess? Yes.
1.2 billion.
You're close, but not quite there. Anyone else? You get some candy for guessing. Okay, 2.3 billion people in the world use sources that are compatible with inline chlorination but are fecally contaminated. Okay, so now I'm going to turn it over to Megan Lindmark, who's the CEO of Mangrove Water. She's going to tell you a little bit about Mangrove Water's mission.
Thank you, Amy, for that intro. Yeah, so Amy was just stressing, right, the value that inline chlorination has and the potential it can play. And mangrove water exists to help meet that value, right? We want to scale inline chlorination to ideally reach all 2.3 billion people who could be reached by inline chlorination. So Mangrove's purpose is to bring together folks like all of you, right? Implementers, academics, funders, the folks making the technology, bring all of those people together, and then ultimately work to support the actual implementers who are working to install and implement inline chlorination. So our model has three major components. The first is freely available open source resources. So Amy already mentioned our playbook that we're launching today. You'll see that come up multiple times over the course of our session. But this will also include things like installation protocols, frequently asked questions about chlorination, a catalog of available technologies to do inline chlorination. And these are all open and freely available, broadly applicable across many different contexts. But then stepping kind of more narrowly, we can think about tailored technical assistance. So this is actual support built around specific implementers and specific contexts, taking this broad guidance and making it context specific to wherever implementation is actually being done. So this can include support around assessing infrastructure for compatibility, determining what kinds of technology are specifically compatible to the infrastructure that you have, as well as capacity building components, so workshops, trainings on how to install and consider inline chlorination. And then the third piece is the Turritap chlorinator. So you can see that sitting over here on the table. This is a liquid chlorine doser that Mangrove is working to support the implementation of and the distribution of. It is currently available for sale through Davis and Shurtleff in Kenya. And so these can be purchased today. And of course, Mangrove is technology agnostic, so we're not only recommending the Turritap. This is just one technology that we're supporting the distribution of. Quickly, before I pass things off to our next few presenters, I want to thank the field implementation teams. So you're going to hear from a lot of folks on US and northern based teams, but we have many field implementers that we want to thank for their valuable contributions, and also note that they can't be here today. So the Uduma team member from Mali was going to be present but couldn't get a visa. We were going to have several additional folks online from Self-Help Africa and the World Bank, and time zones and things like that resulted in constraints in which they couldn't be here. So we just want to make sure that we're giving the emphasis to the people who are actually doing the on-the-ground work that is making this scale that we're discussing today feasible. So up next, I'm going to go ahead and introduce our first speakers. We have Dave Wilson and Aaron Crossett from Givewell, who are going to talk a little bit about the cost effectiveness of ILC implementation.
Sorry, bear with me while I use so many laptops. All right. Okay. Great. Hi, everyone. I'm Aaron Crossett. I am a program officer at Givewell, and I lead our water team with Dave Wilson. And today we're going to be talking about expanding cost-effective ILC implementation. So really quickly, I know I have 8 minutes, and we have 8 minutes, I have 4, so I'm going to run a tight ship here. Quick intro to Givewell, how we're thinking about cost-effectiveness broadly, and with inline chlorination specifically, what we think is the gap for ILC implementation at scale, and expanding ILC implementation in countries with high need, and sort of what Givewell has been funding in the space so far. So, okay, introduction to Givewell. So Givewell is both a fundraiser and a grant maker. And Givewell was created to answer the question of, where should I donate my funding? What is the best use of my philanthropic dollars? And so we help. Our role as researchers and grant makers is to help donors understand where their donations will have the most impact, in particular by finding programs that will avert mortality or improve lives the most per dollar, and then also publishing our research and our grant making and just making it ideally very easy to engage with our work, what we've done, our assumptions. And it's important to note that while Dave and I work on the water team, Givewell is sector and region agnostic. So Givewell ultimately cares about directing funding towards the most cost-effective programs, regardless of sector. So we tend to fund a lot in malaria, vaccines, malnutrition, and within water we've been focused a lot on water quality. And we'll get to this later, but modeling cost effectiveness of the grants is a key part of our grant making process. Okay, so inline chlorination is one of the water interventions, the water quality interventions that we see as most promising. So I think that's for a couple of reasons. First is we rely on, as many of you know, a meta-analysis of chlorination programs that finds a substantial reduction in child mortality. Inline chlorination doesn't require significant behavior change. It doesn't really require as much on behalf of the end user as other types of water treatment interventions at point of collection or point of use. And our hypothesis is that there are fewer WASH funders, or fewer funders generally, focused on improving water quality relative to water access, and so therefore that's sort of what pushes us to fund currently exclusively in the water quality space. Okay, how we think about cost effectiveness. So hopefully this doesn't turn people off, but so this is just a simple model of cost effectiveness, and I'll just run through a really quick intuition, because this is really, I think, captures sort of how we think about whether a given intervention is going to pencil well or look cost effective by Givewell's perspective. So, so as I mentioned, this is a simple model. So we start with a program, this program cost here. This is arbitrary, just assume that $1 million for a grant. Think of that as the total cost of a grant for implementing inline chlorination. So then we divide that by the total number of people that we estimate will reach the program to arrive at annual cost per person targeted by the program, $3. We also want to know, we heavily weight the averting the death of a child, and so we need to know what proportion of the population we're targeting is under 5. So that's that next, that third parameter here. And then the next thing is we want to account for what we call the counterfactual water treatment rate. So absent inline chlorination, how many people are already treating their water through chlorination or other treatment methods? And so as an extreme example, we wouldn't want to target inline chlorination in a region that has 100% of the water is treated as chlorinated, because we wouldn't expect there to be any counterfactual impact. All right, I feel like I'm already running through my 4 minutes here, so I'll just go quickly here. But the last thing, the last couple of things is the chlorination rate achieved by the program. So this is ultimately, we typically benchmark this to program monitoring and evaluation in a given country, or RCT evidence, or both. And then finally, just bringing this all together, you can see our little calculations here. We will calculate the additional the total number of under 5 children drinking chlorinated water as a result of Givewell funding. And then using national level estimates of mortality, and our treatment effect, basically, what we expect chlorination, the effect of chlorination is on all-cause mortality for children under 5 who are actually drinking clean water. We arrive at the bottom line estimate is the cost per child death averted. And so this is, for the sake of this example, this is just a mock example for ILC in northern Nigeria, but it comes out at around $6,000 per death averted, which is roughly on par with other types of programs Givewell funds, again, like seasonal malaria, chemo prevention, vitamin A supplementation. Okay, and so last thing, this is just really trying to draw out the intuition of what is going to look particularly cost effective for a Givewell program. So just to run through a couple of these quickly, all else equal, a program, countries with higher burden of disease, higher mortality burden, higher share of mortality attributable to enteric infection, those are going to look more cost effective in Givewell terms because there's more room for improvement, basically. I mentioned earlier, baseline chlorination rates, all else equal, the lower chlorination rates or water treatment rates, the more cost effective a program will look. And the last one I want to mention is just cost. Again, all else equal, a program that's cheaper is going to look more cost effective, but I just want to flag that this does not mean that Givewell is prioritizing whichever program is cheapest. Again, we focus on both sides of the ledger, the cost side as well as the benefits side, or the anticipated program benefits. Okay, so hopefully that gives you a rough intuition of sort of like how we think about cost effectiveness with respect to inline chlorination. And I will turn it over to Dave.
So hi everyone, I'm Dave Wilson. I'm Senior Program Associate at Givewell on the water team with Erin based in New York. So I'm not going to dwell too much on this slide because Amy scooped me, but yeah, this is just making the point that there's, we think, a massive population who could benefit from ILC who aren't currently being served by it. And I think that corroborates our experience speaking to implementers and other funders and hearing about large investments in piped water access without treatment, either any treatment at all or without adequate treatment. So one of Erin and my areas of focus over the past year has been trying to fill only, admittedly, a very small share of this gap. And so we launched a request for proposals earlier this year to try and identify organisations who could implement inline chlorination. It was a RFP focused on chlorination in general, but with a focus on ILC. In particular, looking at countries with the highest under 5 mortality rates, where we think we could have the biggest impact. And we got a really positive response for this. When we started this, we did forecasts of how many people would apply. I forecasted 12, I think, and in the end we got over 200, which I think is reflective both of the level of sector interest in ILC and also the urgency many implementers are feeling right now in the aftermath of the USAID cuts. So this map shows the grants we've made so far. A few things to call out about this. So we're taking what we think of as a portfolio approach to ILC, funding multiple pilots through different implementing partners with the aim of testing out different models and seeing what might work best in different settings. There's a mix of different types of implementing organisations, so obviously some massive international NGOs and also some local and regional NGOs as well. So Rima Care Integrated Development Centre in Nigeria and Nomadic Assistance for Peace and Development in Somalia, both regional or local NGOs, and in one case in Madagascar we're funding a consortium of private companies. These are also in a mix of different settings, so some in refugee camps, others in more stable contexts, but the common denominator is all in settings with very high under 5 mortality rates, where we think we can have the biggest impact. And it's not mentioned on this slide, but it's also worth calling out that all of the implementing partners will be working with our partners at Mangrove Water, which we think is important because ILC is technically complex and some of the orgs don't have prior experience of it, so we think it's important for them to get expert advice. So this is the final slide, just to say that we think this is a really good learning opportunity to understand what type of ILC implementation works best in different settings. One thing to note is that we've asked all of the implementing partners to work with an external evaluator or survey firm to collect data on a common set of program performance indicators, so things like what chlorination rates they can achieve, E. coli at the tap and at the household level, to see how effectively the ILC devices are treating drinking water. And we think this is important because a lot of the evidence base that we're relying on at the moment is from small time-bound studies rather than implementation at very large scale. And we hope that also this will allow us to compare different settings, different implementation strategies, what it looks like in refugee camps, for example, versus in more stable settings, and also to compare different types of inline chlorination device as well to see what works best. So that is it from us. Are we doing questions now?
Maybe one.
Yeah, one or two questions. No questions? That means we can stay on time.
Thanks Dave and Erin, and just for future people who ask questions may get candy, so just encouraging participation. Sorry, but up next we have Claire Chase from the World Bank.
Thank you, so much. Glad to be here. As Megan said, we would have liked this presentation to be one of our country team members, but unfortunately with the time zone and other commitments, they were not able to do it. So I will share 2 examples, but I can certainly connect you with our team members who know a lot more detail. So yeah, as was mentioned, we have not been doing a lot of chlorination as far as I know in our investments, which is a shame, but I will talk a bit about that. So I think we all know what are the barriers to better quality water in low and middle income countries. One that I'll just pick out here has to do with a lack of knowledge of water quality risks. So I was just recently in Pakistan, and sorry, I shouldn't have named the country, but anyway, the perception was that the water, that as long as you tested the water at the source of extraction at the beginning of the project, if it was clean, you didn't have to do any treatment. And I was just absolutely shocked about that, because we know the poor quality of infrastructure and what can eventually enter into that system. But I think the other thing is that water quality has not really been prioritized for investment. So up until very recently, and I'll talk about that a little bit, even the World Bank was still looking at just improved levels of access. And even our basic level on the service ladder for JMP does not include water quality. So we have not been as focused on the water quality aspect as I think we really need to be. So these are findings which I think corroborate what I just said about the lack of quality being associated with the actual source. And I'm sorry, this is really tiny, so you probably can't see it, but let me just talk you through it. So this was a comprehensive water quality survey that was carried out by the government of Ethiopia in 2016, supported by the World Bank and the JMP. Nationally representative looked at a bunch of different water quality parameters, including the microbiological contamination. What was surprising, so what you're seeing here is the unimproved sources. So clearly, nearly 100% of those sources, the middle column is at the source and the final column is at the household. Nearly 100% of those were contaminated. But what was really shocking is the improved sources, 78% contaminated at the source, and then clearly, as would be expected at the household, you get an even higher percentage that were contaminated. So I think this evidence is not specific to Ethiopia. We see this all over the world. So as I mentioned, the World Bank has just recently transitioned to looking at basic and safely managed levels of service as part of our corporate scorecard. Up until 2024, we were still measuring improved levels of access for all of our beneficiaries. So now this is a huge transition, and it also means that there's a much more attention to how we're going to achieve water quality. I remember in 2014 supporting a project where we were talking about water quality at the household level, and the response from the project team was like, there's absolutely no way we can do that. We're not there yet. So, but now we absolutely have to be. So what you see here is, and again, this is very small, but you can go to the World Bank Corporate Scorecard and see these figures country level. In our portfolio now, 175 million expected beneficiaries for at least basic water supply, sanitation, and hygiene. When it comes to the safely managed side, it's a percentage of that. And as of now in the portfolio, less than half of that is going to be safely managed, so 52 million. But I think we can do better, and these results that are in the portfolio now, we can get to safely managed levels, and I think ILC is one of the very promising opportunities. So I will share now just two examples, and I think what these demonstrate is the potential scale that can be achieved through these type of investments. So this is work that's been ongoing for at least 5 years now. They're on to the second phase of this program in Brazil, in Bahia State. The initial program supported 175 water and sanitation systems. They were moving from a municipal managed system to these centrais de agua in 59 municipalities, and the total beneficiaries of that project were over 100,000 people. As part of these systems, and you can see this is what it actually looks like, a very arid area, but these are what the systems look like. They included daily monitoring of the residual chlorine. The operators were required to deliver control sheets on the water quality to ensure compliance. After the end of this program, which was in 2024, not a scientific study, but they did look at the differences between the municipal managed systems and the centrais de agua managed systems, and found huge differences in the water quality, and also higher satisfaction from beneficiaries and indicative lower levels of waterborne disease. So as I mentioned, this project is being scaled up under a second phase, which is going to expand to an additional 100,000 people. The other program that we're supporting, much larger, is in DRC. This one was just approved in 2024, and the first phase will cover almost 3 million people across 4 provinces. So this is urban, peri-urban, and rural systems, all of which will be incorporating chlorination. In the rural systems, they'll be using the inline chlorination system approach. And then as part of the standard infrastructure package, they include the water quality sampling kits and the technical assistance for water safety and corrective actions if they find contamination. And I think what's really exciting about this program is this is a long-term engagement over 10 years that's already been approved by our executive board and by the government, which is eventually going to reach 12 million people. So this is huge for what we can, again, like getting to your cost effectiveness and the potential for impact, I think is very promising. So just to mention a few of the, I think the barriers, some of these were already mentioned, but I think the one that really I feel like we're facing a lot is this diversity of infrastructure. So even within countries, right, we're working across multiple provinces, very different hydrologic, geologic conditions, which require a lot of variability in the systems and how those are designed. And sometimes, well, oftentimes we don't really have that clarity at the beginning of the project because it depends on the engineering designs that are done when the infrastructure is ready to be contracted out. So that's something that I'm looking forward to, really like the technical guidance from the work that Mangrove is doing to support that. I think another challenge that we always face is on the supply chain, right? Ensuring that we have the chemicals and the materials that are needed to put these systems in place, and just making sure that that's part of the whole working of the service delivery model. I would also say community engagement, that's been one of the things that has come up, which I think is a barrier that certainly has a solution. We can get beyond that, but making sure that communities are invested in this and that it's understood what's going into the water and that that's going to be a protective intervention. So I think opportunities, and I liked the little graph that you had in your slide, but that's basically what I wanted to say here. I think there's a lot of work that needs to be done on generating demand. Like I said, I was quite surprised to hear some of the pushback in the project that I'm supporting in Pakistan. So I think we still need some of that sort of, sharing knowledge and engagement on what successes are out there and what we can learn from other case studies. The technical assistance is going to be critical, so really look forward to the work that Mangrove is doing and also learning from some of the others here. And then I think as much as we can leverage the partnerships with those in the room and others. And these are the contacts of the DRC and Brazil projects, if anybody would like to reach out. So thanks.
Questions for Claire, if anyone would like to ask.
No candy? Can I have a piece of candy?
Yeah, you absolutely can.
Presenters get candy.
Great, thank you so much, Claire. And then up next, we will have Eleanor from Uduma presenting. And then as soon as she finishes, we'll have a short video from the country director who couldn't be here with us today.
Thank you, Megan. Yes, similar to Claire, our country director couldn't come to the US, so I'm presenting on his behalf. So I'm going to talk about Uduma's experience in launching inline chlorination services in Mali in fragile context. So I'm going to first recall what's Uduma model, then dive into the pilots, discussing progress, challenges, and results so far. So very quickly, Uduma is a private water utility operating in West Africa, delivering water to 1.5 million people approximately in rural areas. So Mali, Côte d'Ivoire, Burkina Faso and Benin. Delivering water through 3 types of facilities: large pipe water systems, medium solar water stations and small hand pumps. Why 3 types of facilities? Because at Uduma we really believe in the area-based approach, where we would take into management all the systems within an area so that everyone has access to water, even the most remote areas, and where less profitable systems are subsidized by more profitable ones. So now the pilots. So we received a grant from Givewell to launch a 50-month pilot in Mali that started at the beginning of the year to really test the feasibility of inline chlorination across 5 rural villages in Mali. So on 10 systems, pipe water systems and solar water stations. The grants cover CapEx, OpEx over this period and technical assistance from Mangrove on chlorination services, Aquaya's work on monitoring and evaluation activities, and a bit of it goes to Carbon for Safe Water for us to explore the potential for carbon credits, because by chlorinating water we become eligible for carbon credits. We have no experience in chlorination so far, so the pilot really aims to answer key questions beyond the operational feasibility, finding the right device for the type of systems in remote areas where we operate, sourcing chlorine, etc., the really technical aspects. We really want to understand the actual costs of what it takes to implement inline chlorinations in such contexts, explore the carbon credits, as I said, and through Aquaya's work, mainly really, understand really the water quality improvement that we would bring, who our end users, user perception, acceptance of chlorinated water. So we launched the pilots. We have 3 phases. First one was really start. Second one, installation of system, calibration, so really the technical part of it. And here we are in this 3rd phase, the O&M phase, where we really implementing monitoring procedures, maintenance, testing, regularly testing. There are the ongoing audits to really see what we are doing. Now into the reality of what's going on. We faced different, and continue to face, but we face different challenges. The first one is really around finding the appropriate device for the type of systems that we manage in rural areas and remote areas. So we tested 2 systems, that work with chlorinated solution and erosion systems that work with chlorine tablets. Both have pros and cons, as you can see on the right-hand side. But really the challenge for us is to find the appropriate device for smaller solar water stations that are in remote areas. Sorry to repeat myself, but that's really the challenge. So in this area, you cannot expect to find someone that can prepare the chlorinated solution, that can perform the regular monitoring and respond to the standards that Dosatron requires. So we installed erosion systems, but we faced dosing issue because it's less precise. The second challenge that we experience is linked to the scale at which we operate. That's a pilot, but we're a rural water utility, and it's hard for us to find distributors that are reliable, that are able to sell chlorine and have quality after-sale services. So that was another additional challenge. The third one, I mentioned it briefly, but it's quite broader. In the regions where we operate, it's hard to find high qualified local staff, and even if we train people to perform the tasks that are required for chlorination, it's hard to build this autonomy and have less involvement in the operations. So that's adding complexity to the issue. And then the last challenge, something that we can less control, is not a technical or supply chain challenge, but it's adding complexity, is linked to consumption. So with seasons, of course, but even within seasons, from one day to another, you can have a completely different consumption pattern, which makes it complicated to have the right concentration, dosing, etc. So we managed to implement responses to those challenges thanks to Mangrove support on the technical aspects. We also worked on having a contingency stock management to have spare parts, etc. These are very practical responses. We're going to also test alternative chlorinators for the future scale up if we scale up. But really what we learn is it's a continuous refinement, increased supervision on operations, etc. And really, for example, when we receive chlorine, you have to add procedures to test the quality of the chlorine that you receive, very practical. Despite all of this so far, even though it's the beginning, we see positive results from the pilots with all E. coli tests so far that are negative. We observe stable free residual chloride, community that value chlorinated water, and we faced minor operational issues only. So overall, very positive results, again in a challenging context where security situation elevates the overall risks in Mali. So our pilot really shows that inline chlorination is feasible, but it really needs continuous adaptation, monitoring. It's not just about finding the right systems for the type of system that we operate, but it's also building really the capacity to increase the resilience, robustness of our systems operations in order to be able to scale up effectively. Thank you very much. So this is a message from our country director in Mali, Gilda Soumé, who is
Good
online.
morning. My name is Gilda Soumé, Country Director of Uduma, Mali. In this pilot on water chlorination in rural areas, my role has been to oversee the coordination of the entire project, making sure that the technology is properly deployed and adapt to very remote environments, that the field team are supported at every stage, and that any operational challenge is addressed quickly so that the service to the population is never interrupted. This project is above all a social mission before being a technological challenge. Our team spends countless hours on community sensitization because a rural project only succeeds when community truly understand purpose and make it their own. You cannot simply introduce the solution, you must build it with them.
Time for probably one question for the Uduma team. Yes, right here.
Yeah, have there been any challenges associated with other water quality parameters like IPOC rating?
Sorry, can you repeat the question?
Have there been other challenges with managing, other water quality parameters like IPOC, since that can cause
So
formation?
the pilot was not focusing on such aspects. So it was mainly bacteriological test and having the right chlorine concentration for now.
But that's a great question, and that's one of the resources we're working on. So happy to chat about that more in the breakout session.
I just had a quick question. Go ahead. I think maybe John, did you ever hand up, John?
Yeah,
Real quick, John, and then we can
Yeah,
go
yeah.
more.
So just to pull up on your challenge on environment consumption, you mentioned that because of the variable consumption, it was difficult to dose. And so this might be a basic question, but I want to understand, in my mind, like for like the erosion device, it's based on the flow. So if it's variable, would that affect how the dosing?
Yeah, because you would have the chlorine tablets that sit in the systems. I'm not a technical person, but from what I understood, you would have the tablets that sit in the water. If people don't consume, it sits for a long time, and once they consume again, it's just it's overdosed.
And was that a challenge for both devices?
Mostly for sort of erosion systems.
Okay.
Yeah.
It's very context specific for
Yeah.
each device. Tablet dosers can also be modified to address that.
And the other piece I'll add to that as well is in the smaller systems like Eleanor was describing, the chlorine is dosed into a holding tank, but then if that tank is not consumed and it sits, chlorine decays, and so then by the time someone does collect it, you have a lower dose than intended. So there's kind of two different factors that can influence the end point chlorination concentration.
Thank you.
I think it was, you had a quick.
Thanks. Thanks so much for your presentation and the video message. I guess I'm just curious what your next steps are. Are you gonna, you mentioned trying out new or other technologies for inline chlorination, but is this a new direction you want to continue to go as a utility?
So the pilot is ending in March, and we're gonna have to propose for the scale-up to Givewell. To be fully blunt, we're gonna, but before March, we're gonna test alternative chlorinators to see if it works better for our context, and then based on the overall conclusions, the baseline, inline results, etc., we'll be able to make a better proposals.
Yeah, if you can make it quick, Jeff, we can take it over.
Okay, yeah, you just said high capex, low capex for dosatron versus the erosion chlorinator. So could you put some numbers on high and low?
Oof, on the top of my
They're in the
head.
playbook.
You set this
Thank
up.
you, Annie, for saving me. Also, you told me you were going to ask a simple question. It's just that a dosatron is more expensive than erosion system, and it's also serving a higher number of people. Yeah, that's all what I can say on the top of my head.
Yes, yeah.
I was just curious if you saw like an increase in chlorinated water consumption in community after you implemented the pilot.
I think it's a bit too early to say, because we finished the installation of the systems in September. There was a baseline survey conducted in June, and the inline is going to be in December, if I remember well. I think by this time we'll be able to say whether there was an increase or not, but it's too early to say. Thank you.
Thank you, Eleanor and the Uduma team. And up next we have Will Tillett from Self-Help Africa.
Hi. So I'm glad most of the questions were put to Uduma, so hopefully you won't have any for me. So I lead the water security wash and waste work within Self-Help Africa. But a lot of the content that I'm going to be presenting today are, as Megan suggests, from colleagues who work much more intensively on the ILC work in Nigeria, in Gambia, and my colleague Matthew in the UK. So they're joining online, so I'm going to push any technical questions that you might have to them. I think it's great to follow some of the other presentations, particularly by Uduma. I think this is quite a complimentary presentation of a large-scale service provider, and then for us, where we work in different countries, essentially helping to incubate and performance improve localized service providers in a more kind of decentralized way, and strengthening the wider systems around that. So I think there's going to be some similarities and some contrasts there. And what does that mean in terms of supply chains, capacities that are needed, etc. So, whilst we work across WASH in 11 countries, most of our kind of rural water service delivery model strengthening is specifically in Malawi, Gambia, and Nigeria. And in Malawi and Nigeria, in Gambia and Nigeria, we've been lucky enough to receive funding to look at inline chlorinators more extensively. And we're still quite early days in Nigeria in collaboration with UCB, and in Gambia with IVAG, if I pronounce that correctly, right? So where the contexts that we work tend to be sectors that don't really necessarily have a strong kind of sector regulatory framework and requirements and enforcements around ongoing water quality, functionality, and kind of downtime. So we work in professionalising maintenance, localised maintenance service providers, building with demand and willingness to pay for those kind of improved sustainability arrangements and the key performance indicators that are set in terms of zero coliform to household level, 95% functionality of targeted water points, and 48-hour maximum downtime. In those countries that we're working in, the sector is very far off track in that, particularly in places like Nigeria, where I think the sector average is 42 days downtime, right? And so, so you'll see what we do in terms of trying to strengthen the broader system around making professionalised services work, and also we've been working on carbon credits since 2013, one of the earlier movers there, and also get uptime results-based funding in Malawi. And so we essentially repurpose some of that results-based funding to performance-based incentivising the local service providers to achieve some of these KPIs. We started working with ILCs, we're still very early in the process, but essentially through the carbon gold standard requirements, which shifted from zero coliform at point of delivery to zero coliform at household level. That gave us a lot more kind of skin in the game of needing residual chlorine in the system. So we are delighted to be working more on inline chlorinators, and we're also delighted, to be frank, to find a product that can work on hand pumps, not only pipe schemes, because in Malawi, like, most of the water points are still hand pumps, right? So we're still quite early in the process. So I think point A's come up quite a bit, right? But I think maybe a contrast between very large-scale programming of the bank, for example, or where Uduma is essentially a large-scale service provider and will have to work out its own supply chains. What about where you're working with these small decentralized service providers and working at a pilot that hasn't yet got to the scale where you can start working with the local private sector in terms of looking at the supply chains? One thing that we've been really keen on is working on a locally fabricated product called CTI8. I'm not going to give you any technical details, I'll push that to our specialists. But what's great about that is you can locally fabricate it. It's quite cheap, but also it's a bit more flexible in terms of the type of chlorine and product you can put in there, which is very useful in terms of supply chains. It makes it a bit different to some of the other products on the market. Point B's come up quite a bit, and this really came strongly from both Ebie and Mohammed in Nigeria and Gambia, and you see the quotes there. But essentially what we're doing is putting some infrastructure on generally a community-owned or perceived community-owned water scheme that is kind of intercepting the water that's coming out of their water point before they can start drinking it, right? And we can't expect acceptance straight off the mark. And I think behaviour change is really key, but I think for us it's the word trust. Trust of, is this chemical perceived more like medicine, which we managed to get it framed as medicine in Gambia, or is it seen as something which is sort of making people sterile, and who are these people? And so for us, utilising community members who are from that community to be the champions, to be drinking the chlorinated water in front of people, the local health extension officers from that community, but also the operator, the local caretaker being someone from the community, is really important. But what does that then look like in a professionalised management service where you don't want to work on community-based management? And so in Gambia, for example, it's linking up a community-based caretaker who then falls within the wider professionalised service provider and service delivery model. I think this is obvious, right? But the strength of the chlorine dosing is so important to get right, and really varies on a day-to-day basis, as I think came up earlier. And even to add to the explanation earlier, we put some inline chlorinators on gravity flow schemes where the yield is going up and down, right? And so we have introduced ILCs intensively on projects where we had this kind of strong monitoring framework with EVAG and UCB, and we're really keen on following up on a day-to-day basis of the first 3 months and then ongoing. But we also implemented them in Malawi and Gambia, where we don't have such an intensive focus, but we put it in. And then we realised that actually the chlorine levels are going pretty high. It wasn't day-to-day followed up. And then the community was just like, no, we don't want this. So what I'd say is, it seems obvious, but don't underestimate the intensity of that particularly first 3 or 4 months follow-up, and build your staffing base and your rate of scale-up really mindful of that. And then don't look at chlorination in isolation. I think it's really clear when you're working with Uduma, it's clear that you're integrating chlorination within a service delivery model. But I think in the past, maybe chlorination-based interventions, particularly on more like dispensers, etc., were sometimes seen more as a health sector intervention than a wash sector intervention, depending on the country context, right? And also, like, you know, the household water treatment. So for us, it's really looking at what's the role of how do you integrate the requirement for chlorination within the ongoing service standards, the oversight by the local service authorities. You know, as long as there's potential funding to carry on chlorination, great, it'll carry on. But once that funding stops, there's not necessarily any incentives for the service providers to carry on and that extra cost, unless you build the wider framework around that, and I think, Claire, you touched on that. So yeah, it seems obvious, but an inline chlorinator is not going to work if the water point is not functional. If the water point is not flowing. So for us, that's where we really are coming into this and saying, look, we have to look at the wider service delivery model, integrating that. I think I'm out of time. I'll just leave that on the slide, but that's very much from a kind of smaller practical perspective of how we found technical assistance working with EVAG and emerging experience with UCB has been really useful. So thank you very much.
Got time for a couple of questions for Will.
No technical questions, please. Unless Matthew's online, hopefully. Yeah.
Okay, so like treating groundwater with chlorine is very challenging because of heavy metals and like ions. So, and like keeping the dose is really challenging. I'm not so sure about the settings and how you actually manage that.
Okay, so it's something, this is where Matthew would be great to join online. It's not something we've come across as a significant issue. I mean, we've been, on the gravity flow schemes, we've been really mindful of turbidity. And then we've been looking at the iron levels. But I don't know, UCB side, is there anything you want to add on to that, on Mangrove side?
Yeah, sure. I think it's a really important question, and it's something we've been thinking about a lot, and Jeff has actually been thinking about it a lot too. But one of the resources that we're thinking about working on is screening for chemical contaminants, priority chemical contaminants. And I think there's a lot of questions about when to do it, and how to do it, and to make sure that you're testing with the right methods, and then how do you use that information? Because there are some, I think, situations where people are going to continue to use that water point, and so there's a question of whether or not you should do chlorination or not if they're going to be using it anyway. So anyway, I think it's a great point.
Yeah, like, you know, there is a threshold for like chlorination. If there is a heavy metals or particularly the ions is there. So
yes.
We found the 6 ppm if the iron level, you cannot chlorinate them.
Yeah, that's also a great point. So iron can interact with chlorine and make chlorine.
The color changes and it looks like a red oxide.
Yeah.
And manganese. Anywhere is
manganese. Yeah, any metals actually. Yeah. So it depends on where it's the setting.
think was there a hand with the back area?
Yeah, do you mind to talk more about the supply chain issues that you ran into? Like what did you have the most trouble supplying, and also how have you been troubleshooting with the supply chain?
So I think the biggest challenge is just the scale of the initial work, right? So if you're starting at a tiny scale, you can almost bring stuff in a suitcase, right? You can bring your reagents in a suitcase, you can bring some of the kit. But as soon as you're starting to work on kind of 50, 100, that's when it starts to become much more of a challenge, because it's not big enough to really incentivize the local private sector. But it's also, it becomes a bit fiddly to start looking at imports and cost effectiveness around that stage. In terms of one of the areas that we've been looking at in Nigeria, and we've got some colleagues who have recently been there as well, is not just, you immediately think of like the supply chains for the facilities themselves and chlorine, but it's also the reagents. Like, where are you going to get the reagents from? And actually, we've been needing to look at who has, because the reagents are perceived as kind of medicinal side, we're actually looking at working with the pharmaceutical supply chain to be able to get some of those reagents locally. But I think this locally fabricated kit is super useful. And like in Gambia, for example, turns out because there's so much tourism, there's a lot of swimming pools. And so like, can we use the chlorine tablets they use in pools to be able to be part of the supply chain there? And so it's just looking at the kind of the chemical aspects of that, and that's where our academic partners are so key, is to make sure that their chemistry is right.
Great.
Cool. Thank you.
Thanks, Will, and thanks to all of our wonderful presenters. So up next, we're going to briefly introduce the playbook that we've been talking about and hinting at throughout this session. And then we'll move into more opportunities to win candy and prizes, I promise. The inline chlorination playbook is really guidance that is meant to contextualize installing, operating, and really maintaining inline chlorination systems broadly, regardless of context. So we also have some one-pagers with this QR code again, and I will show the QR code again, but I see a couple of cameras still up, so I'll wait to transition. So there's a couple of different sections that I want to call out that are in the inline chlorination playbook. The first of which is a technology catalog. So you've heard about several different types of chlorinators already today. Included in this playbook is 10 tablet chlorinators and 3 liquid chlorinators, and we have information regarding each of them, including procurement and pricing options, as well as the kinds of infrastructure that might be compatible with these chlorinators. And then we briefly get into kind of the O&M requirements that are specific to each device, as well as, and I'll get into this in a second, the more broad O&M requirements. We also focus a lot on the technical requirements. So this gets into infrastructure compatibility, but the kinds of flow rate, pressure, and head loss that you can expect or need to make sure you're meeting in order for a chlorinator to be compatible with your system. And then finally, we share briefly kind of the implementation record that is known, as well as known evaluations of each of these technologies. Next, besides device-specific O&M, we have a brief section that gets into the kinds of staffing recommendations. Will was already mentioning the kind of emphasis that you need to place on staffing, especially as you're installing and beginning to calibrate these systems. As well as the actual day-to-day and month-to-month O&M tasks that are required broadly to do inline chlorination. So if you're thinking about starting an inline chlorination program, you can kind of map out what it's going to look like both at the early onset, but also in perpetuity as you sustain these systems. And then next we get into monitoring best practices. So you already all started to ask some questions about this, but we focus on the kinds of chlorine monitoring methods as well as recommended frequency. But we also get into the potential water quality monitoring best practices for E. coli, which can pair nicely with chlorine to understand whether or not chlorination is happening effectively. We mention a few other water quality monitoring parameters when appropriate, but we imagine that there will be more guidance on this forthcoming. So that was just a brief introduction. Now we want to come back to the more participatory portion of this session. So we are going to have a Mentimeter. I'm going to leave this QR code if everyone wants to scan it. You'll participate on your phone. We will have a kind of a live brainstorm, first around the barriers to chlorination, but then second regarding the actual potential solutions and resources. I'm going to show the QR code again if you haven't gotten it yet. All right, so should be able to, yes, great. We'll leave this up for a second and let you all think. I love whoever said none. That's the right attitude. You're right. We can overcome all of these things. Great. So I'm seeing some big ones emerge here. Supply chain. So I think almost all of our presenters touched on this, right? This is going to be one of the key factors for any implementer is thinking about, and not just the supply chain of the devices themselves, but also the supply chain of the chlorine, right? And the reagents necessary to do chlorine monitoring. All of those things are critical. I'm seeing acceptance and taste as well, and dosing I'll kind of lump in there. So of course, community acceptance of these systems and ultimately of the taste and the odor associated with chlorine is critical. And so you'll see in the playbook some kind of preliminary guidance around how to socialize chlorination programs and engage with community both prior to the implementation of inline chlorination, but also after, and respond to kind of any community level responses. But there are also additional factors. You can control how you dose at the beginning to dose lower and slowly build up a chlorine dose. And so these are some of the small pieces that are included across this playbook. Let's see, I'm also seeing infrastructure and variability. So I think that was touched on as well by all of our presenters, right? So these are widely compatible technologies, but they do, your infrastructure will kind of control for which devices make the most sense. Great. So our next Menti question is, what is one resource for implementers that would be critical for scale? This can be anything and everything. I encourage you all to be creative, and this is where we'll take the breakout groups next. So this brainstorm will feed into your breakout groups. You can also you can like and upvote others' suggestions if you see one that you wanted to say, but you would just like to support it. I'm seeing money come up a couple different ways. Yes. Yeah, funding definitely a key factor. Perhaps a barrier we can overcome. I think we might know some people who can support that kind of thing. Yeah, these are all great recommendations. So I'm seeing, how to build specific devices, right? So installation guidance and materials on what materials you need to actually construct the CTI 8. So that's also something that will be part of a later version of the playbook specifically. I'm seeing call out on engineers, and I think this is really important, thinking about the local capacity both that you have on staff as well as the capacity that you can build through training and support from Mangrove resources and other resources. Great. I'm going to leave these up, but we are going to move next into, I'm going to pull these back up, but first I'm going to share the instructions about breaking into breakout groups. So we are going to divide up into groups, and we are going to focus them on these 4 themes. So in just a moment, I'm going to ask you all to move and collect into 4 groups, kind of circle chairs. I think this is a tough room to do that in, but we're going to try to do kind of the 4 corners. I'm going to allow you to self-select, but if you all go for one, I'm going to come along and make you move. So try to be somewhat even, but up in this corner, we're going to have technologies. Up in this corner, we're going to have supply chain. And the back will have monitoring, and then on the other back side we'll have scale. So go ahead and break now, and I will give you some more instruction once you're seated in your group.
And if you have an idea for another group, you can start your own.
Yes, if you have an idea for a different group and don't like the social options we've given you, feel free to collect in the middle. Technologies, up here by me.
Yeah, we should.
In this other corner, we'll have supply chain, and then monitoring and scale in the back.
Just as a reminder, do you want us to facilitate the groups?
Yes, yeah, and I'll have questions up on the board, so just keep the discussion. Yes, scale. Technology, or supply chain technologies.
I like to bring up
on the spot if you want to move up.
And then for people joining on Zoom, we're going to be posting the questions just in 1 minute. I think we just want to invite you all to engage in the chat related to some of these questions, and then we'll try to share back with the rest of the group.
Megan, is monitoring part there? Yes. Okay, monitoring is in that one. This is technology. Okay, where do you want me to go, Megan?
Where do you think I should get technology?
Technology or supply chain?
Technologies.
How are we distributing sort of group leads? I'm happy to sit there, I just don't know what we're trying to
I'll put these questions up really what the goal is, then we'll have these guiding questions and discussion, and then that's on the third page of the second.
Who's reporting back?
It doesn't be you, but it can be anyone. So you have to decide.
I think Claire's
A bit more facilitation, yeah.
Can we use that word?
Please.
Yeah.
Okay, I think everyone's kind of settled into groups. Quickly, I just want to share these instructions. So we'll have 3 guiding questions. You're all going to spend about 10 to 15 minutes in each of these groups. Discuss the biggest barrier, and this is going to be related to the theme of each of your groups. Discuss some key resources, and then discuss opportunities. So at the end, you'll all designate someone to share out what you think the best potential resource to develop for inline chlorination implementers will be, and then we will vote, and there will be a prize for the team that comes up with the best idea based on peer voting. So please keep that in mind. It is more than candy. It's pretty exciting. It is not a curry tap. Yes.
I tried. Can you present it so it's bigger?
Yes.
Thank you.
And then for a group on Zoom, if you can just engage in the chat, we'll try to share back your responses as well with everyone in the room.
Next, so.
I'm Mark, I'm from your freshwater, and
Nice. Okay. So I think we should start just talking about what we think are the biggest barriers related to technology or scaling. I have lots of.
Okay, maybe I can start. So from my experience, I work a little bit different. I think human-centered design technology is not there. From my experience, so always industry thinks something and they push this for the community or the household level, and where there is resistance after the funding end and after the project end, that's not. So human-centered design, and better to plan for community level for supply rather than household only strategy. Because now women are really at household in local community is very engaged with their own work. So if you put the responsibility to women, the household to treat their own water, that will not work. So better to design innovative solution that community led, not household. That's my first initial comment on technology.
So do you feel that there needs to be more technology available to approach? Or do you think like it's about the
You said
actual
6,000
installation
you're operating 6,000 and 6,000 schools, so 6,000.
Their scale is.
I'm not up to date about that.
But no, this is fascinating because this is like, your intel
I
is the
think
best intel.
definitely there is a need of new community large water.
But 6,000,
like
like 6,000
supply large volume of water, minimal
8,000 units at
with
6,000.
less refilling.
And these are
So these are critical things for community or household level because people are getting busy. We are habituated to actually getting water without putting any effort. So that's our habit. And if you ask me to regularly put something or switch something for treating the water, I will not do that because I have different job, I have different tasks. So from the community perspective, I found at the local level, keeping one person for the model needs to be actually about keeping one person to treat that things or manage that things if possible, not the ownership, not leading to the women or voluntary about that. So that's the thing. And it should be like refilling type of, if it is like you have to refill something, chlorine, it should be like at least a longer frequency, not like every 3 days or 7 days, because you will not get the part.
Thank you, Steve. Thank you. Thank you. But no, but you currently don't.
That's my initial thought, yeah.
But how do you refill? How do you ship the product?
We're not yet.
I'm from Nepal. We are also promoting such kind of inline chlorination system, massive chlorination system in Nepal, especially in the rural context. And in rural context of Nepal, the major water supply system is gravity water supply system.
Have 700 devices.
And there are more than 2, 3, 4, 5 water sources in the single system. One of the major challenges we are facing is installation of number of inline chlorination systems. How many number we install, because it's quite expensive and very low affordable for the rural context. This inline chlorination system
One of the recipients of the upcoming Givewell grant, and something that we have been discussing with Givewell and team for horticulture office
in the system, pipeline system
of producing chlorine locally.
No, simply we know canvassing.
I really have
Picture, I think one of the presenter presents.
It's like you're trying to handle like the stack of cameras.
And my experience is very
It's a candle.
basically
It's a
communities were
solid
solid
candle.
world.
Chlorine candle. One of the
If
presenters
it's done
presented,
properly,
I saw that picture, the same kind of system we are adopting. So the challenge is how many such systems installed in a single system, because only one doesn't
I'm a bit skeptical myself, but this is something that we have
another one
discussed
challenge is
with
if we are going to install in the whole system, the wastage of chlorine chances of because the water treatment is not only for drinking, the other purposes as well, like other uses of it. So it makes the chlorine consumption faster and costly. Such kind of innovative technology.
The one that happened.
Spring and steam both.
That was like
Glacier.
Spring is groundwater.
Can I go? I'm just.
Very interesting, the pictures of the time. Any other?
So having to chlorinate all water safety requirements, I think there are some benefits of chlorinating all water for household usage. But
Where?
that makes a lot of sense.
You use the CTI
Because the cost for
right?
the cost of the device
And where are you getting your
or
tablets?
for
Installation and the frequent changing
And so far, I haven't met anybody who says.
chlorine chemical.
And are you having to, is there a supply
Quite
chain
expensive,
difficulty you're encountering?
as we all know, the supply chain is also the road country.
Are you manufacturing your own
No.
devices? You're purchasing? You would be interested in manufacturing, like, the CTA, the second source devices can be constructed by local materials.
That may be one of
Would it be helpful to have like a how-to video of how to tackle?
very limited suppliers are available in Nepal. That may be the solution. Because we need to keep huge stock. It will make larger scale of production warehouses because if there is
So I have one question about once you say that it's expensive compared to water.
Yes, all of a sudden.
Is it like no chlorination or?
No chlorination, because you already know that chlorination is a new thing, especially in the rural context. Local acceptance level is also low. And it must be encouraged to of the chlorination. Frequent changing of chlorination system and buying the chlorination system is expensive.
It's difficult,
Okay, anyone else? I think we're still on.
We are part of the problem, I guess, but we are also pretty much the only, so it's a bit of a chicken and egg, and it's again on supply chain and efficiency.
Okay, any other?
We have implemented the Aquatis
So I think it's just
it was quite
pretty
but we not have time
No, you're not.
About liquid. Okay, so we can talk about generating your own solution. But what about what do we know about supply chain for just liquid chlorine that would be used in dosatron, for example?
For liquid, I think you compare it's like oral cycles working really well.
I'm also wondering about like different.
So okay, so with powder, so with granulated, I guess it's granulated or powder.
Yeah, but I think
Surface
find it everywhere in Kenya. You find it
so
in Nigeria. It's just very sporadic with all the rain.
I think that's
So
I'm also thinking
so
about
variability, a variability, so not only for tablets, but I guess that you have this not only for tablets, but for dosatron, you buy powder, you mix some water. It's the playbook.
Then you have the intention to at some point, but in terms of how the working rules are changing.
This is like super crowdsourcing.
Okay, and anyone else before we move on to
I would say this is one of the challenges that there for this problem. There's not many key sources that we've identified that are reliable.
It's a variable source.
I mean, I see
Surface
lots of
water,
sessions.
variable on rain extracts, stays in the well, which is going to oxidize out all
I think
the
it's
dissolved.
maybe because of the Givewell effect, there is a lot of
benefit for
momentum in
that
the sector.
bacteriological care.
This is something that
So, you know,
and I believe that
precluding everything else,
if we are able to use
water quality analysis.
this momentum and to use Givewell as a convener of all these experiences
So
to really
variation in source
build
water
experience
quality
and to
with
use
no
like
There's a couple of that's that aren't necessarily related to technology, but the regulatory process to introduce new technologies and getting political funding for that takes a process, takes a long time. And then in terms of the O&M for any technology, presenting that up front and very clear about it, having a supply chain that's enough for the technology itself in country instead of imported from the Philippines. Are other aspects of continued use of that technology in the
India right now.
All right, everyone, we're going to take 2 more minutes on these breakout groups, so just try to finalize thoughts if you can. Sorry for rushing you. 2:50.
And just be prepared to share back your top line resource recommendation.
And if anyone on Zoom has anything to add, please feel free to add it in the chat, and we'll try to report back as well.
So I heard how to video.
I wonder if
because they say how to build a device. That's one potential resource. Bring down costs. Letters are actually preparing a device. Anyone else?
Is there, so I haven't gone through the playbook yet, but is there a way to use kind of like decision trees in situations, and here's some options that space out?
Yeah. Yeah, I think we thought a lot about that. We don't have it in there yet, but another idea might be like an AI.
Any ideas on this one?
It's not directly connected.
What are supply chain related
And
opportunities?
there are some other questions that are not necessarily
I did, but I meant to start, yeah, I've seen what I'm like, not connecting the dots in my head.
Yeah, that's like technology.
There's another whole conversation about chlorination for
Developing
healthcare
remote
cleaning
sensing for
environment.
monitoring for individuals.
Huge
remotely,
needs.
that
They're
would-
also they're looking at supply chain issues. That's
that
where
would be
they're
great.
focused as well. I wonder if there's a way of like combining so that the level of need is great enough to warrant the market. So,
Okay, everybody, we've got to go ahead and wrap up. So if one person from each group could go ahead and stand up as the reporter. I know we're having great discussions, but we stand between you and posters and happy hours, so we are obligated to keep you moving in that direction.
I think it's just pick a group to start.
Yeah, this front group is going to win the prize just because they're ready. Who's the reporter for your guys' group? You want to come on? I don't know if we have a mic that works.
Yeah, that's working.
Okay, first group is going to go ahead and report back. If you could go ahead and share what group you're representing and what one resource you would recommend. Or should I just focus on the resource? Or give a quick summary and then the top line resource.
All right. Can you hear me well? So I'm representing the supply chain group, and in terms of barriers, we've identified quite a lot around quality, and we focus mostly on chlorine, on the chlorine supply chain, just for be sure. So we have quality and safety requirements, barriers, the challenges around finding existing local, in our case, African-based distributors, given maybe like a small lack or no market available, the challenge producing locally, and the cost, and while maintaining the cost effectiveness. And now in terms of resources, I mean, we love the idea of the supply chain working group, which we heard is not just for supply chain, but obviously very excited about this, the playbook, and having an inventory, like what would be helpful is an inventory of existing like manufacturers, who, yeah, instead of trying to find everywhere and find information from ourselves. And then in terms of opportunities, keeping the momentum with the great work that Givewell is doing, pushing water treatment, and we also talked briefly about how basically consolidating and taking advantage of everyone's skills instead of all working in silo, again, for supply chain, yeah, questions.
Thank you, that's perfect.
We're gonna pass it to this front group next.
We're the tech group. So we're gonna talk about AI, obviously.
So we're the technology group. We went through several barriers around source water, issues with technologies themselves, but where we landed in terms of the new resource was an AI-based decision tree that would help identify which technologies are appropriate ILC-wise for your context. Voila.
Thank you. All right, we've got the monitoring group back here.
Yeah, it turns out it is a monitoring group. I thought it was scale, but fine. So, but quite a lot of it links with scale, right? And so there was aspects around the volume of the sample size and the intensity of it, and kind of how much is enough when you start looking at monitoring at scale and the cost drivers around that, how much in terms of the household surveys and then other water point surveys. And then there's a question around who does it. Is it going to be the same teams, the service providers or the implementing agencies that are fixing the water point and then doing the water quality, and is it going to be the same people, and what's cost effectiveness around that? But more in the medium term, who should be doing monitoring of water quality and compliance? Really, it should be the local government or the decentralised service provider, and building the capacity there, but also where's the cash going to come from for that? We gave the example in Malawi where the district water officer's annual budget is like $2,000, and there's lots of funding for the implementing organisation to do it through funders, and that data is primarily going to the funder, not necessarily to the government. So you use that as a question around the kind of, yeah, the data, but also who pays for that, who should do it. Supply chain and reagents was identified as a potential barrier for the scaling there as well, and the suggested resource or the silver bullet was, I mean, if we can have remote sensors that look at inline chlorination, you know, sort of residual chlorine, that would be great, and particularly as our colleagues from IRC are working in fragile contexts, hard to reach contexts, then some sort of remote sensing that has high confidence levels would be really useful.
Great, thank you, monitoring team. Well, if you could pass the mic to the scale team.
Hi, I'm Dave Wilson from Givewell. Erin and I did a bad job of facilitating, and so we only got to the barriers. So some of the barriers we discussed include lack of technology options for inline chlorination on hand pumps, including in humanitarian settings in places where there's still a high reliance on hand pumps, challenges with community acceptance of chlorine, the heterogeneity of the water infrastructure in many low-income country contexts. That means each ILC installation has to be customized and different. How to incentivize system operators and other stakeholders to keep chlorination going in the long term, and local implementation activities. And sorry, we didn't do the rest of it.
That's okay. I'm hearing multiple resources there,
So
but
your resources
hand
list
pump.
of barriers.
I heard hand pump compatible. I'll see. All right.
Somebody's working on that.
I don't know. So one final Mentimeter slide here. Hopefully you still have that up on your phone. If not, I can go back to the QR code.
And what do they win, Megan?
I'm so glad you asked. You win. Your team, when you'll have to share, so make new friends. Your team wins a beautiful bottle of wine. And a Toblerone bar, as well as additional Halloween candy.
You can see the rating in real time.
Yeah, only about 9 of you have responded so far, so it's too early to call.
So we should then either.
No. All right, about half of the vote is in. So far, remote sensors for chlorine monitoring are leading the way.
Supply chain working group. Another working group.
All right, I'll let a couple votes keep trickling in, but I just want to kind of provide some concluding remarks on the session today. Before you leave, please put your chairs back into place, but thank you all for coming. Basically, what I'm hearing is that there's a lot of opportunities for inline chlorination. So thank you all for providing some of these additional resources that would be useful. I encourage you to engage with the playbook and provide feedback on the playbook. So grab a one sheet and I'll show the QR code one final time as folks are leaving. Tomorrow, during the lunch, there will be a technology showcase, and our CTO, Jeremy, will be demonstrating this Turry tap and its hand pump compatibility. So that's one problem that is already potentially solved. Please come check that out at lunch tomorrow in the Sunflower Room. And if the monitoring group would like to come and collect their prize before they leave, please go ahead and do so.
That was a good session.
Thank you. Thank you for having me. I know, you really did. Yeah, you got the creative Yes. I can make that happen.
Hi, I'm presenting.
Yes.
Nice to see you. I'm presenting, so I have to run, but I would love to find, as much time as.
Yeah. Are you here for the
I'm leaving Thursday.
Okay, great.
Evening.
Well, yeah, you're presenting now. I have that on my calendar. I'm trying to make it depending on how quickly people get out of here.
It's not my work. I'm presenting on behalf of someone. So
Okay, well, then
less
stop by
pressure.
your poster.
Okay, I know. I saw you kept trying to come, and
I didn't want to interrupt, and I knew we would have time to chat. So I did read the poster, and I have thoughts. But yes, I would love to find time, maybe Thursday or maybe tomorrow even.
Yeah, either.
I'll reply to your email with some time.
Yeah, and I'll send you like my WhatsApp or whatever if that's easier.
Yeah, that would be great.
Email I'm slower on.
Yeah. I'll let you go to your presentation.
Okay.
I don't want to get any further, but
I'll send it to you and we'll find each other. So this is fun. Thank you.
Hi, Andrew. Nice to meet you. Yes, I know. I've seen you a couple of times and I've been like, oh, I got to talk to Andrew. But yes, how are you? Excellent.
I like the presentation and everything.
Thank you.
I also love the breakout session. It was really helpful.
Yeah. Okay, good. I'm glad to hear it. We wanted it to be as like interactive and fun as possible, which is easier said than done in an afternoon session, but it was a good crowd. So, and does it work for you to meet a little bit more formally during happy hour tomorrow? I think I emailed you back. Did I email you back? It's possible that I didn't.
Maybe I can double check.
I probably put it in my calendar and then didn't email you.
Megan, I'm thinking maybe a little brief photo at the end of this. Could be
I think
quite
that
nice.
would be a great idea. Thank you.
Shall I just?
Yes, yeah.
So I mean tomorrow, like during the happy hour session now.
Yeah, do you want to chat with me and Jeremy and Amy then? Yeah, okay, great. Yeah, we've got lots of opportunities and I'd love to have you involved.
I would love to be a part of it.
Okay, awesome. Thanks, Andrew.